For decades, doctors have told every patient the same thing. The ideal blood pressure is 120/80. Lower is better. Get that number down and keep it there. That is the goal. That is what protects you. And if you are 35 years old, that advice is reasonable. But if you are over 65, and especially if you are over 75, that number may not be protecting you. It may be putting you in serious danger. My name is Dr. Miles. I have spent 13 years in emergency medicine, and I have watched seniors arrive in my department dizzy, confused, unable to stand without their knees buckling, whose blood pressure was sitting at exactly 120/80. Their doctors were pleased with that number. Their charts looked perfect. But their bodies were failing because the pressure keeping blood flowing to their brains was too low for their age, their physiology, and the medications they were on. Today, I am going to tell you the truth about blood pressure targets for older adults. I am going to give you the actual numbers, the real targets that research now shows are safest for seniors. But I am not going to give you those numbers yet. Because if I tell you the number right now, some of you will write it down and leave. And if you leave without understanding why the number is different for seniors, you will not have the full picture you need to protect yourself. Stay with me. This information could prevent a fall, a fracture, or something far worse. First, I need to tell you about Margaret. Margaret was 77 years old when her daughter brought her to my department. She had not fallen. She had not had a stroke. She came in because she could not stop feeling dizzy every time she stood up, and her daughter was terrified. Margaret had been on blood pressure medication for 9 years. Her most recent reading at her doctor's office was 122/76. Her doctor was delighted. "Perfect," he told her. "Exactly where we want you. Keep doing what you are doing." But Margaret did not feel perfect. She felt exhausted in a way that sleep did not fix. She felt her legs go weak every time she rose from a chair. She had stopped going to church because she was afraid of standing up in the pew and losing her balance in front of people. She had stopped cooking full meals because standing at the stove made the room tilt. She told her doctor. He told her it was probably just age. When Margaret arrived in my department, I checked her blood pressure lying down. 122/74. Perfectly controlled by every standard guideline in medicine. Then I checked it standing. 88/56. Her systolic pressure had dropped 34 points the moment gravity pulled blood away from her brain. That is called orthostatic hypotension, and it is one of the most dangerous and most overlooked conditions in older adults on blood pressure medication. Margaret's brain was being starved of adequate blood flow every single time she stood up. Her medication had pushed her pressure so low that her body, with its aging arteries and slower vascular reflexes, could not compensate fast enough when she changed positions. She was not dizzy because of age. She was dizzy because her blood pressure was being kept at a number designed for a 45-year-old inside the body of a 77-year-old. Those are two completely different physiological environments. We adjusted Margaret's medication that day, carefully, gradually. We let her pressure come up to 138/80. The dizziness resolved within 2 weeks. She went back to church. She started cooking again. She told me she felt like herself for the first time in 2 years. Her previous doctor never connected her symptoms to her blood pressure because the number looked right on paper. The number was right for someone else, not for Margaret. Comment below right now, do you get dizzy or lightheaded when you stand up? Comment the word dizzy. This is a critical warning sign that your blood pressure medication may be too strong for your age, why seniors are physiologically different, and why the rules change. To understand why 120/80 can be dangerous for older adults, you need to understand 3 things that change in your body after 65 that your doctor may never have explained to you. First, your arteries stiffen with age. Young arteries are elastic. They absorb the pressure wave when your heart pumps and release it smoothly. Older arteries are stiffer. They cannot expand and contract as efficiently. This means your body needs slightly higher baseline pressure to push blood adequately through those vessels, especially upward to your brain, which sits at the very top of your circulatory system and depends on consistent pressure to receive adequate blood flow. Second, your pressure-sensing reflexes slow down. Inside your blood vessels are sensors called baroreceptors. Their job is to detect when your blood pressure drops, for example, when you stand up and immediately signal your heart to compensate. In a young person, this happens in seconds. In a person over 70, these sensors respond more slowly. If your baseline pressure is already at 120, and your sensors are slow to react when you stand, your pressure can drop to dangerous levels before your body corrects it. That is the window where falls happen. Third, your medication sensitivity increases. As you age, your kidneys and liver process medications more slowly. A dose appropriate for a 55-year-old stays in the body longer and acts more powerfully in an 80-year-old. This means blood pressure medications can lower pressure further than intended, and that excess lowering happens silently, without any obvious sign, until someone stands up too fast and goes down. What the research actually shows. The traditional 120/80 guideline came primarily from studies conducted in middle-aged adults. Very few major trials specifically examined people over 75, and the ones that did found something that contradicts what most doctors were trained to believe. A landmark study following adults over 75 found that those with systolic blood pressure between 130 and 140 had the lowest mortality, lower than those below 140, 20, and lower than those above 150. The group below 120 showed increased rates of falls, fainting, acute kidney injury, and death. The group above 150 showed increased stroke and heart attack risk. The safest range was the middle, not the aggressive low target that guidelines have promoted for decades. This is not a fringe finding. This is peer-reviewed research that is actively reshaping how geriatric medicine approaches blood pressure management. And it means that for millions of seniors currently being medicated toward 120/80, that target may be doing more harm than good. The real target numbers for seniors. Here is what the current evidence supports and what you should bring to your next doctor's appointment. For adults between 65 and 75 who are generally healthy and active, a systolic blood pressure of 130 to 140 is associated with the best outcomes. This provides genuine cardiovascular protection without the dangerous drop in brain and organ perfusion that comes from pushing too low. For adults between 75 and 85, a systolic target of 135 to 145 is more appropriate. Arterial stiffness and slower baroreceptor responses at this age mean the body needs a slightly higher baseline to maintain adequate blood flow when standing, walking, and moving through daily life. For adults over 85, or for anyone who is frail regardless of age, the priority shifts entirely. Preventing falls becomes more important than hitting a textbook number. A systolic range of 140 to 150 is often the safest target, because a fall at 85 can trigger a cascade of decline that no blood pressure number on a chart can prevent. One additional number that is critical and almost never discussed. Your diastolic pressure, the bottom number, should generally stay above 65. When diastolic drops below that threshold, blood flow to the heart itself during its relaxation phase becomes compromised. Watch that bottom number as closely as the top one. How to check for this problem at home. If you are on blood pressure medication and you experience dizziness, fatigue, difficulty concentrating, or weakness when standing, do this test today. Lie down for 5 minutes. Take your blood pressure, write it down, stand up immediately, and take it again. If you're systolic, the top number drops by more than 20 points when you stand, you have orthostatic hypotension. That is a warning that your medication may be too strong for your current physiology. Take those two numbers to your doctor and ask for a medication review. Do not adjust your medication on your own, but do not accept dizziness as a normal part of aging either. It is not. It is a signal. Margaret is doing well. She walks to church on Sunday mornings. She cooks dinner every evening. She is not dizzy. Nothing about her health changed, except one number on a prescription adjusted to fit her age, her physiology, and her actual body, rather than a guideline written for someone half her age. That is what this channel exists for, to give you the clinical picture that a 10-minute appointment cannot always deliver. If this video gave you information you needed, subscribe right now. Every video I release is built on 13 years of emergency medicine experience, delivered clearly, without confusion, and without agenda. Hit subscribe so you never miss what comes next. And tell me in the comments, what is your current blood pressure reading and how old are you? Just the numbers. I want to see what people are actually running. I read every single comment. Thanks for watching. I will see you in the next video.